Okay, when you're ready.
Good evening, everyone. Hope you're all well. My name is Deb Ranson. I'm a clinical nurse consultant. Welcome to our third episode in this series. It's actually brought to you by the veterans group No More Zombies. And welcome. Our presenter tonight is Robert Collier again. Robert has had a remarkable career, about 20 years in the industry, spanning the globe. He is an esteemed keynote speaker, as some of you will already heard the series before. Expert consultant in endocannabinoid therapies, genetics, cultivation, regulatory proficiency as well. Tonight, Robert will be addressing his actual personal involvement in clinical trials, as well as profiles and cannabinoid varieties that may be really effective for PTSD and particular veterans, of course. Couple of housekeeping things. Put your questions in the chat. We will get to them. And just quickly remember that this does not constitute as medical advice. So welcome to you, Robert.
Thank you for the introduction, Deb.
Welcome.
Thank you very much for this evening, and we will get started. Okay. First of all, our episode overview this evening is going to be about what varieties may be effective for PTSD, what sort of methods these were cultivated in to obtain those profiles, and then we are going to look at a 50 veteran patient trial conducted by Dr. Mina and myself. So we have a good few things we're going to cover here tonight. So the cannabinoid varieties we're going to look at is the purple Afghan, Canatonic, Ninja Kush, and CBD Express. We will start off with a variety that's been around for a very, very long time in the medical field, and that is a variety that's known as the purple Afghan. It originates from, as its name says, northern Afghanistan. It has a bright to dark purple color, so the bottom of the flower has a kind of a pink to light color purple, which then flows up into a very dark, deep color, which then covers the rest of the entire flower. This variety has been around since the 1970s, so it has. It's been pretty much a staple in medical varieties going back millennia. It is not something that's new. It's been around for a very long time, and it has always been very effective. It was in the 1980s as to where it was actually bred with the skunk, and that we are more familiar with the name purple Afghan, or otherwise might be known as the purps, or grape ape is another name that is has been known by. All of these varieties are very, very, very similar, and they're all descendants of this original purple Afghan from the 1970s. No other purple varieties really exist that haven't come from this one to begin with. The purple Afghan, it generally has a flowering time of anywhere from 65 to 70 days. It is a long, long history of being used as a heavy sedative and muscle relaxant. So it is. Now, it is only suitable for nighttime use. It is not something that we will be saying to an individual or a patient that should be being consumed during the day on account of its heavy sedation. It is not something that's going to allow you to engage in your day and conduct yourself in accordance as it needs to be done. This is much more for rest, for bed rest, and for sleep aids. That's what is to be used for. The THC levels of 20% and above are usually in that region, anywhere from maybe 19, 20, up as far as 23%, as long then as having another couple of minor cannabinoids in there as well at the same time. Those cannabinoids, a lot of them we're already very familiar with: THC, CBD, CBG, CBN, and CBC. Because of its actually history of coming from Afghanistan, it does also can produce a couple of those rarer cannabinoids on occasion. Now, as I said, these are rarer cannabinoids. They are not usually found inside the flower. We locate this when we have converted the flower, whether that be into its traditional hash form or into an oil form. That's where we will find much more of these rarer cannabinoids, and as well as from to be able to be actually detected, rather than in the flower, where we only found small trace amounts of each of them. Then when we look at, obviously, what's very important about this variety is actually the terpene profile. Now, all of these purple dominant varieties that originate from the purple Afghan are all heavy in myrcene and caraphyllene and linalool. They're the three most common terpenes that you're going to find. After that, then you'll find some ocimene and some smaller concentrations of limonene and phytol. Now, it is to be noted that that's exactly as to what you need for this variety to be effective. What can happen is there is some purple varieties out there that also have pinene in it. These varieties are not to be consumed by people who are trying to get the sedation effect from purple Afghan, the purps, or grape ape. The pinene can actually cause you to be a little bit more alert. It can cause you to be more aware. And that's not what we're looking for in a variety when we want it to have its sedation effects. So if it has pinene in it, it's not the purple Afghan that you're exactly looking for. What this does lend itself to is with the aromas that come from it, and aromas of lavender, grape, pepper, spice, and just a hint of rose that comes just as part of the undertone. It is all part of what exactly makes up this variety. Now, the purple Afghan is also well known for its flavonoids that it produces. Now, this one, the purple pigment that we are very familiar with, comes from anthocyanins. Anthocyanins have been widely studied, so they have, because you can find them in different fruits and vegetables. They are not just simply based in cannabinoid profiles. What these have been looked into, and when we see the studies were conducted, it may be helping to be anti-diabetic, anti-cancer, anti-inflammation, anti-obesity, and it can help with cardiovascular diseases. We do find that the purple varieties does have a high concentration in it, and this can be very, very beneficial to a couple of other areas that the variety provides care for. Now, when we start to look then as to what these varieties may be effective for, what they've been used for traditionally is, number one, insomnia and muscle spasms. That's it. If you're having trouble sleeping, this variety has been studied a lot, that it may be very, very helpful for with restlessness, night terrors as well. Now, when it comes to night terrors, you know that when we're looking at PTSD, it can be a very, very common occurrence. This variety is very, very good for possibly not having them occur as much. And we're not saying in any way, shape, or form that this is going to stop the night terrors completely, but it definitely has the potential to drastically reduce their occurrences. And that's what we're looking for in these sort of varieties. When we then start to look at how exactly these varieties have to be cultivated, that is extremely important. Because this variety originates from Afghanistan, it has a high tolerance to different environments. It is relatively easy to medium to cultivate, as well then as having a medium yield. Now, when we're looking at varieties that are being cultivated on a commercial basis, this is why sometimes this variety can be overlooked, is because it isn't exactly giving the yields that people would like. or from a commercial point of view, that's what's required for it to be classed as a productive variety. Now, we're more along the lines of a productive variety is a variety that's actually effective for its patients. So we would like to see this variety being grown a lot more, as it has kind of lost favor over the last number of years due to its not having that highest yield. But it is something that needs to be looked at for future generations as well. When we look at then for the tolerance of over and under feeding, this is where we mean by it can be relatively easily produced. High tolerance of nutrients, low tolerance of nutrients. It can go through a drought, it can go through a little bit of overfeeding, and it's able to bounce back and respond to it and still give the profile required at the end to make it beneficial for what we need it for in this case. Also, as well, to ensure that you get that full terpene profile, to make sure it's actually working and those terpenes are all there and expressing themselves, it has to be cured for a minimum of 25 to 30 days. Now, what we mean by that is it needs to be stored properly, needs to be burped for the first couple of days to make sure that we start to break down those, what is the word? It's the green plant inside it. We'll move on. So to get its full terpene profile, you'll have to excuse me on that one. The next variety that we're going to be looking at is cannatonic. Now, chlorophyll, that's the word I was looking for. Yeah. Cannatonic is a variety which was developed in Spain during the mid-2000s by CBD crew. It was created using African, Pakistan, Mexico, and Afghanistan varieties. It was pretty much more well known to people in the early 2011 when it was renamed as Charlotte's Web by a group in North America. It was featured on a CNN documentary for its effective treatment of the VAT syndrome in Charlotte Figi, resulting in increased popularity of this variety. That's pretty much as to how it got well known. You would be more familiar with it under the name of Charlotte's Web. We're much more familiar with it with a cannatonic. This variety, being derived from a number of hemp varieties, has a flowering time of 60 to 70 days. Now, CBD has a very long history of being used for medical. If we look back at our first episode, we can start to look towards O'Shaughnessy, who was able to redo some of the trials conducted in the 1840s to show that CBD has effectiveness, as well as the history behind it to show us how effective it can be. This variety is much more suitable for all day use. So whether that be from the morning time to get you going in your day, or whether it be consumed throughout the day whenever it would be required. With CBD levels of anywhere from 8 to 22% and THC levels of 0.5 to 10%, when this variety was originally created, it was about 1 in 4 was giving the high CBD count, and then we had some equally balanced varieties, and then we were leaning towards someone having a little bit higher amount of THC in them. Now the ones that we're concentrating on have very high amounts of CBD, and little to no THC is found in each of them. When we start to look at the cannabinoids that are found in this, obviously, number one would be CBD. We would also then have some THC, some CBG, some CBN, and some CBC. Because these varieties are derived from landrace hemp varieties, we do find these rarer cannabinoids can pop up a little bit more often than they do in other varieties. The rarer cannabinoids are more like CBGV and CBDV. Not a huge amount of them is found, but they can be found in there from time to time. When we start to look then at the terpenes that is in the cannatonic variety, this is where it gets its original belief that it was quite good at relaxing and can be a little bit sedative. That is on account of the high myrcene content that was in these varieties to begin with. They will contain myrcene, terpinolene, caraphyllene, and linalool. Small amounts of humulene, pinene, and limonene were also found. The pinene in this is quite important because that's what gives us our alertness and keeps us active in our day, as well as kind of helping to overcome the sedative effects that can be felt sometimes by myrcene. Then this gives us aromas of peppermint, mango, and sweet and sour. As these are more terpenes, are more leading towards those aromatic hemp varieties, it is the mango and sweet and sour tends to come out a lot more, with the peppermint as a kind of more of an undertone that does be in there. When we then start to look at the flavonoids that are available in cannatonic, the most popular is cannaflavin A and cannaflavin B. We find this in a lot of different cannabinoid varieties. Then when we start to look at quercetin, and we also have camphorol, which is also found in this variety, and some luteolin. Now, each of these the luteolin has been looked at as an antihistamine. And when we look then at the quercetin, it has reported anti-inflammation, anti-fungus, antibacteria, and cardioprotectiveness as well. These are very important when we start to look at how effective a variety might be, and the colors that are in there can give an indication as to what other flavonoids might be available and as to what exactly they can be effective for also. But we don't know what's in there without proper trial and testing, of course. Cannatonic has been used widely. It is a very widely studied variety, as CBD is widely studied. Most of the CBD trials that were done would have been conducted using cannatonic. It would have come under different names, but this is the original variety it was originally spawned from. This obviously, as we know, there's a lot of research that has been done to show that CBD may be effective for anxiety, depression, muscle spasms. There's a lot of research has been done around epilepsy, chronic pain, mental sedation, and inflammation. When we then start to think about as to, okay, how are these varieties cultivated? Because it is derived from hemp varieties, it is a very easy variety to cultivate. So it is compared to some of those compared to the last one, like the purple Afghan. This one is very easy to cultivate, indoors, outdoors, greenhouse. It has the tolerances, so it is able to tolerate over and underfeeding, and can also produce very large and heavy yields. It is usually the variety that cultivators would start out with, so they can understand exactly as to how their systems and processes work in place. And then once you start to get a good yield from this, you start to move on into a much more complicated varieties. On account of its background being a hemp variety, this variety has to be cured for at least a minimum of 21 days. Personally speaking, I know of these that can be anywhere from 20 to 60 to 90 days curing to bring out that full terpene aroma. Now, 90 days isn't always beneficial for a cultivar when they're trying to commercially produce a product. So no matter what, we say that it has to be for a minimum of 21 days, at least to start getting that full myrcene terpene profile being activated. The next variety is a personal kind of favorite of mine. That's why it's kind of here. What can I say? It is a variety I've developed myself, and I've used it extensively in PTSD for many, many, many years. Ninja Kush. Ninja Kush was originally developed using varieties from Japan and Afghanistan. It gives a beautiful flora of colors that includes red, purple, blue, and it has what has been referred to me and more than once as a deep narcotic smell. Now, when we say a narcotic smell, it is very alluring. Once we've had patients that would smell it, they would instantly go, oh, this is something that I believe is going to be beneficial to me. That's the number one thing we've always been told about. The Japanese varieties are more along the lines of hemp landrace varieties, some of them that originated around Russia and Asia. Prior to World War II, Japan had a very long history of cannabinoid and hemp use for medical purposes. Ninja Kush brings this unique genetic background right back around, as nobody has seen anything like this since before World War II. And to this day, these wild hemp varieties are still grown in Japan. They are eradicated every year under UN guidelines, but with proper search and proper tracking, as we would say, we believe that these varieties will be coming back. Japan is now moving towards its medical market, and we would hope to see that there'll be a lot more work done in these varieties in the future. They do hold some very special and unique traits that we don't see anywhere else in the world. The Ninja Kush is a little bit longer of a flowering time than what we're used to when it comes to an Afghani variety. With a flowering time of anywhere from 65 to 75 days, it is once again only to be used in nighttime. This variety, when used during the day, kind of puts people into a state where they don't engage, they don't interact, and it kind of shuts down the thought process and the motor functions inside the body. All you want to do is relax and go to sleep. That's exactly what this variety was created to do, and that's exactly what this variety does. The THC content of this, because of those Afghani varieties have always been high, can be anywhere from 18 to 23%. And because we were using landrace CBD varieties, we can have a CBD content of anywhere from 1 to 4%. It contains those usual cannabinoids that we come across: THC, CBD, CBG, CBN, and CBC, as well as an account of it being from Afghanistan. You can find the rarer cannabinoids like THCV on account of having that CBD for landrace background. We can also find CBDV and CBGV. Not as common, we more likely see the THCV pop out in it than we do any other cannabinoid. Once again, we kind of find that they are much more suited to when it's put into a resin or an oil form, as to where we can get a much more better idea around the full profile that's available. This variety is also very, very high in myrcene, terpinolene, carraphenolene, and linalool. Small amounts of humulene, ocimene, and limonene can be found. And also on occasion, a little bit of pinene can come out. But as I said, that's not a suited variety when we're looking at for sedation and for sleeping. We don't want any pinene in there whatsoever. So again, they're not selected varieties. It comes out then with aromas of spice, pepper, vanilla, and cedar. Sometimes the vanilla comes out over on top, along with the pepper and the spice. I think that that's what gives it that much more unique smell and aroma to it, that you're not going to find in many locations or many varieties. The flavonoids that we find in Ninja Kush are a little bit more. It has canaflavin A, B, and C, is found very, very often. Rutin, was shown to be effective for lowering blood pressure, increased blood flow, and maintaining elasticity and strengthening of capillaries. Quercetin has been used, as we discussed before, to treat inflammation, cancer, arthritis, cardiovascular disorders, diabetes, and it can also be an anti-carcinogen also, which needs to be studied a little bit more. Is what we're looking to with this variety. When we look then as to what it can be effective for, what we have used it in the past for is number one, insomnia, muscle spasms, night terrors, chronic pain, post-surgery recovery, spinal injury and back pain, and restlessness. It is very, very effective in all of these areas, provided it is, of course, it is used as a nighttime variety. If it is used during the day, we've had people come along and tell us that it can kind of be a little bit anxiety causing, simply based on the terpene profile. And if you try to do something when it's trying to put you into a relaxed state, you're working counterintuitively as to what you're wanting it to be effective for. So again, a nighttime only variety. The Ninja Kush cultivar, it is very difficult to cultivate. It is very, very attuned to its environment. It doesn't like too much of an upset. So what I mean by that is, it is a high humidity. It will start to grow mold. In high heat environments, it can slow down a little bit. Now, when it comes to over and under feeding, it has a good tolerance because of its Afghanistan and landrace background. It does have a medium yield, and when grown in living soil conditions where we can push it a little bit further, that medium can start moving into a high yielding variety, so it can. For the curing process, it is at least a 30-day plus process to bring out that full cannabinoid and terpene profile that we want. Anything lower than that, and we don't seem to achieve those flavors and aromas that we're looking for. The next variety that we're looking at is a variety called CBD Express. This again is another daytime variety. Was used using landrace and domestic varieties to create a robust cultivar for indoor and outdoor production. This was the idea behind this one, was that everybody should be able to create a variety that can be effective for them. And this was exactly as to what the idea was behind when we created this. It has thick, dense colors of pink, purple, and magenta, which is really only occurring when in the right conditions. When grown indoors under lights in perfect environment, we don't see those colors as much. When it's more in a greenhouse and an outdoor setting, these colors seem to tend to pop into the variety on a much more basis. The idea of it is that most of the high CBD varieties that were around had derived from cannatonic, and they all had high amounts of myrcene in it. This is where we were looking for something that had much more of a tropical aroma and a little bit more sweet instead of the myrcene that we're more used to. Due to its background of coming from the Lebanon, it can withstand some very, very, very harsh environments as well as conditions. That makes it a relatively easy cultivar for cultivators to grow. And it is very, very well suited for a commercial production. With a flowering time of a more relatively 60 to 70 days, as well as being very, very high yielding. Now, some of the varieties, some phenols of this can finish much sooner, in around anywhere between 50 to maybe 55 days. You end up with a much tighter flower than you do with the longer flowering varieties, but the yield is a lot lower as well at the same time. With CBD levels that consist of anywhere from 6 to 11% and THC levels from 4 to 10%, this variety tends to be very well balanced 90% of the time. Now, while some varieties, some phenols of it can be as high as 18 to 20% CBD with as little as 0.5 to 1% THC. That is more likely what we're kind of looking for varieties like this. We want the THC level to either be matching the CBD or lower. The cannabinoids in this variety, we have the usual THC, CBD, CBG, CBN, and CBC. On account of its long history of having landrace varieties that are more on the hemp side of it, we find a lot of CBG and CBGV and CBDV can be found in this variety a lot more common than they can in some of the other varieties. It was specifically selected for this, for those other cannabinoids in there, to give it the biggest flavor that we possibly could have. When we then started what terpenes are available in this variety, myrcene is there, limonene is there, caraphyllene, humulene, linalool, ocimene, terpinolene. Smaller amounts of alpha-pinene and beta-pinene are found in this variety as well. Once again, that was so we could keep that alertness in it, so we could have it as an uplifting variety to keep people productive inside of their day, as it is a full daytime variety. With aromas of citrus, tropical, cedar, lavender, and just a hint of mint, it can be quite refreshing just as an actual aroma profile just in itself. Again, when we look at the flavonoids that are available in this variety, we start with the cannaflavins. We have A, B, and C is found in this one on a regular basis. Also, when we start to look at as to what other flavonoids are available, we've got beta-sitosterol, which can be effective for lowering cholesterol and improving symptoms related to an enlarged prostate. We have camphorol, which is being used to treat inflammation. It can also be anti-fungicide, antibacterial, and has its cardioprotectiveness as well. When we look as to what could be effectively treated with this variety, epilepsy, anxiety, chronic pain, restlessness, and muscle spasms are a number of areas it has been used historically, and it may be effective for each of those. When we look at the cultivation of this variety, as it is derived from hemp, it is a pretty easy variety to cultivate on a large scale. It is tolerant to over and under feeding, as well as having a very good resistance to mold and pathogens. Well suited for indoor, outdoor greenhouse production. It has I suppose, a medium dense yield. Not overly too large, but you are getting that more compact size flower as compared to some of those landrace CBD varieties that can give you a larger flower. This is much more compact and much more suited for commercial production. Again, these varieties do have to be cured. No matter what way you look at it, it still has to be a minimum of 21 days, whether that be indoors or outdoors. If it's outdoors, we would highly recommend that that was pushed up to maybe 30 to 40 days instead. Now, that's giving an outline of a few different varieties that we work with. Now we're going to talk about an actual trial that was conducted by ourselves, which was using the purple Afghan and cannatonic. Both of these varieties were used at the same time. The cannatonic was used as daytime, and the purple Afghan was used for nighttime. When we were kind of looking at this, it took us a while to make sure that we were going to be running with the right varieties, first of all. It took a number of years to make sure that what varieties we were going to operate with actually had the medical potential that we were looking for. Now, ensuring that these varieties then were grown and stored and prescribed to all guidelines and in line with all legislation that needed to be adhered to. This was all done in Holland. So it was under a little bit of a different preference than what we would have today. And this was all conducted between 2007 and 2009. This isn't something we've done recently. This is something we've done quite a few years ago. We then had to look at this to exactly as to what variances can occur to put the varieties that could put them out of sync. Hence why we made sure that these varieties didn't contain any pinene in the nighttime variety. And we wanted to lower the levels of myrcene during the daytime variety. Now, when we look upon the cultivation as to how exactly they were done, it was all done in an indoor controlled environment under organic cultivation, using organic methods, natural and organic nutrients. Everything was selected from a cloned cultivar. There was no seed used for this. The reason we were using clones is we had to have consistency inside the product. When we're using seeds, we can have too much of a variance. That wasn't acceptable when we're doing a trial like this. Everything was harvested at peak cannabinoid production. And that is when we look and we see that about 85% of the trichomes have turned a milky hue. And we've then got the last 10 to 15%, which is made up of clear and amber, in around the region 10% clear and about 5% amber. The reason this is very, very important is because if we leave a variety too long, it starts, all of those trichomes will turn amber. This will give the variety a much more sedative effect, whether or not it is for daytime or for evening use. So making sure that we are harvesting varieties at peak cannabinoid production to make sure that we can get the full medical benefit from each of them is extremely important. Now, when it comes to these varieties being cultivated in a commercial environment, usually they're left a little bit longer because they give a bigger yield. We're not about yield. We're about as to what is the best medical profile that can be produced from these varieties. And that is when they're harvested at a milky, not an amber trichome. Also, as well as to ensure that these varieties were as effective as they could be, the drying and processing period was 14 days. This was 10 days drying and then 4 days for trimming, packaging, and storing. Now, because an awful lot of the acids and that can kind of give kind of a acidic or nasty taste to some of the flower that would be vaporized or combusted, it is important that varieties are dried with the trim leaf or the sugar leaf still attached. And once it is properly dried, it is then trimmed. It is then cured for a period of 21 days and then stored at room temperature for a further 30 days. After that, it is then put into a particular type of process, so it can be put into stainless steel containers and put into deep freeze. When this is done effectively, it is to ensure that there is no change in the cannabinoid profile that is found in these varieties. When you have a variety that is being stored over a period of time, as to its profile can change. Its THCA convert to THC, its CBD can convert, CBDA can convert to CBD, as well as another couple of terpenes. We want to ensure that none of this happens, as well as to making sure that the terpenes don't evaporate in any way, shape, or form. Hence why it had to be stored in deep freeze for the period of time of the trial. As we were saying before, this trial was conducted between 2007 and 2009 by Dr. Meenan and myself. My role involved with the trial is going through the selection of varieties, the cultivation, the processing, the patient entry, exit, and post interviews. This trial was 50 participants. Each participant had to have served at least 1 year of military service. It did not have to be active service. It has 1 year military service. Everyone that was involved was from the age range of 24 to 56 years of age. It consisted of 19 females, 31 males. We had much of a debate about whether or not we were going to use a placebo in this. And on account of the basis that everyone that was part of the trial had used cannabinoid therapies and endocannabinoid therapies before, and the basis that even no matter what placebo we were to look for, it is still going to have a trace amount of cannabinoids and a trace amount of terpenes in there. So even somebody might find the placebo effective for the first couple of days. And in our opinion, that was something that could skew the results. What was very important was that the compliance here, to make sure that number one is no other cannabinoid therapies could be used through this process. So nothing else could be used. You could only use the varieties that were provided by Dr. Mina and nothing else. Variables for lifestyle for each individual had to be looked at. As not everyone operates in the same way and not everyone's PTSD affects them in the exact same way. So as to how exactly a person's lifestyle and day would occur as to how exactly someone was to consume their cannabinoids and have their cannabinoid therapy. This could mean that somebody could start their cannabinoid therapies early in the morning, or it might mean they don't start their cannabinoid therapies until the afternoon, based on their day-to-day processes. Now, compliance was everybody had to be compliant in this. Everybody had to sign a waiver that they would adhere to everything that we were doing, and as well that they would document all of the process to make sure we can get as much information around it as we possibly could. Then when we started to look at exactly as to how it was going to be put into place, the dosages were dependent on 1 to 3 grams. While some of our subjects were weighing anywhere from 60 to 70 kilos, some of the subjects in this were also up as high as 200 kilos. So making sure that they had the right amount was very kind of, how should you put it? It was something that Dr. Mina was very insistent about. 3 grams being the absolute maximum that a person could consume in 1 day. But to make sure it was actually effective, the dosage was to be recorded, and as to how long it took to feel the effects from each of them. The CBD, which was cannatonic, was to be used during the day, and the nighttime variety, which was the purple Afghan, was only to be used at night. When we start to look at exactly the CBD variety, this is where we were speaking about as to how it has to fit into the individual's routine. What we had found was, for instance, 2 of the participants, they didn't actually feel as though their PTSD or anxiety was being, for lack of a better word, triggered until later on in the evening. So when they were actually going out to pick up their kids from school, whether that be between 3 o'clock to 5 o'clock in the afternoon at that time, it was the noise, the traffic, all of that was what would kind of trigger off an individual. So what we would kind of do is, as we would know, this needs to be, the cannabinoids need to be in the body for them to be effective. So it was a case where we would want it to be used about anywhere from an hour to an hour and a half before it was actually going to be required. We wanted to ensure that the CBD was actually in the body when these trigger events could occur, for to actually start consuming it afterwards when the trigger event has actually happened would not actually be as beneficial as if that was already inside the body. So that's what we mean by working it into the routine of the day, where if they knew they were going to be heading out at 3 o'clock, that this would start to be consumed either at 1 o'clock or 2 o'clock in the day. The consumption method was left for it either to be vaporized, combusted, or put into a tea. Now, that back then, that was one method that was used that could be very beneficial. The flower was ground up, it was put into a tea strainer, and was made into a can of tea. Some people found it effective, other people's not so much effective. It was because it was a CBD variety, it was up to the individual as they decided to have it before, after, or during food, or on an empty stomach. Depending on as to how they activated inside their day, this was when it was decided, working with Dr. Mina, as to what time would be best for it to be consumed. Then when we look at evening time or nighttime for sleep, part of this whole study, we believe that the number one thing that people need is a good night's sleep. No matter what you're suffering from, and no matter what it is, if you can't get a good night's sleep, it is very, very difficult to interact with your day, and it's very, very difficult to keep concentration. And that can lead to trigger events, and it can lead to having a much more stressful day. And stress is exactly as to what we don't want for people that are suffering from PTSD. Now, when it came to this variety, it was recommended to be either done through vaporization, combustion, or again, it could be used with in a tea. Some people also were using this variety in food preparation, but we kind of found that that wasn't the best method for getting the full effect. So it was, the focus was always on vaporization, or it to be combusted. Now, we would again be looking at, everything was measured with being in the body for at least 1 hour. While yes, vaporization and combustion can have you feeling its effects almost instantly, these varieties can work as a slight stimulant, very, very initially, and then they start to kick in that sedative effect. So we would go, okay, if an individual was going to bed at 10 o'clock at night, or if that was the end of their day, we would go, okay, we would advise you to start consuming your cannabinoid therapy 30 to 90 minutes before you wanted to initiate sleep, or if that was how you wanted to end your day, that was when it was to be initiated. This had to be consumed after food. With the few trials that we had done testing beforehand, is consuming high THC before food consumption can cause anxiety, it can cause stomach cramps, and it was preference that this variety was consumed after food. If food was not able to be taken, you would drink some water to at least ensure that there was something inside your stomach and not to be completely empty. When we looked at the results, we ended up with 94% of the participants completed the trial. 62% notice significant improvement. That the 62% was 31 people, which consisted of 10 women and 21 men, which reported high positive outcomes. What we classed as a high positive outcome was anyone that was receiving 6 to 8 hours of continuous uninterrupted sleep, 30 days without night terrors, a severe drop in aggressive behaviors, and improved social interactions. The next area is where we would look at 18% of people had a moderate positive outcome. Now, that 18% was 9 people, which consisted of 3 women and 6 men. A moderate positive outcome is what we classed as someone that was receiving 6 to 8 hours continuous sleep, a decline in aggressive behaviors, improved social interactions, and 15 to 21 days without night terrors. What we then was classed as a mild positive outcome is where we had 5 people, consisted of 3 women and 2 men, little to no improvement, essentially. Now, a mild outcome was where they receive a consistent 6 hours of continuous sleep. Anxiety relief was minimal, slight decline in aggressive behaviors, and less than 10 days without night terrors. Also, at the other end of the spectrum, we had 2 men reported only sleep was improved, with no decrease in aggression, night terrors, or anxiety. The next section, when we start to look at the negative outcomes of this, was within the first week, 3 of the female patients dropped out. The statements that they then was that they did not like the psychoactive effects of the purple Afghan gave them at night. Also, a very common statement was dry mouth. This was looked upon as a common aspect. Adding to the tea, they found was not so much beneficial. It did not provide the outcomes that we would have hoped for, or the individual had hoped for, as well as having an increased appetite before bed and possible sugar cravings. The results all over, it's when we look at it, we see that 80% of a success is what it was actually classed as. So that while a small group may not have got the benefits that we would have hoped for, the majority of 80% of the patients did have a very positive outcome. Dr. Mina later on went along and done this trial again using oil only. So it was the exact same profiles, but in an oil base that consisted of the terpenes, cannabinoids, and was found that it had a much more positive result on night terrors and sustained sleep, especially with the night terrors. So thank you. That's our webinar for this week on varieties that can be or may be effective for PTSD, as well as the trial that we conducted. Please join us for our webinar again next month. And now we will look at maybe some questions that we've popped up.
Beautiful. That was amazing. Thanks so much there, Robert. The science just blows me away every day. I hope you all found that as interesting and eye-opening as what I did. We do have a couple of questions. So we had a couple sent in previous, but we've just had quite interesting one as well. So I'll read them all. Robert, in regards to the oils, disregarding dosages of THC and CBD, how do we find the flavonoids, terpenes, effective to whole cannabis flower? And in answering that question, if so, how are we comparing that benefit of THC CBD versus the terpenes and in the face. In particular, he's talking about geriatrics, mainly RSCF, I guess, stays. We don't tend to use whole hour due to a few constraints. So where kind of does that leave us? So a few questions in there in one.
Right, okay. Well, I suppose when we actually start to look at what is the most effective, really consuming oils with the terpenes inside it is number one. We would use that essentially as a background. So we would want somebody consuming the oil a little bit earlier in the evening, and then using the flower profile to back up and kind of give that oil a boost, let's say. When you're consuming the flower, you're absorbing all of that straight away. With the oil, it needs to go through your digestive system, and it can take a little bit longer to kick in, as well as those terpenes having a little bit longer of an effect before they actually have the effect you want them to have.
And so he was kind of asking in regards to like the efficacy, I guess, like how do we negate the fact that the flower is an instant relief for them. However, the oil's going to take quite a while when it comes to someone, I guess in a nursing home who has different comorbidities and impacts with pain and all sorts of things. How do we make that better? I guess the question is, it's from Reese Beatty.
Yeah, okay, right. To be honest with you, then the only quicker delivery system that we can there is like, so when we look at, I think it was either Sweden or Finland, they managed to, they put a cannabinoid inside a sugar molecule. So they would. So then it was the cannabinoid was being absorbed just as quickly as the sugar was. So when it comes to the oil and that, the drinks, I have found has been probably the most effective way and the most quick onset as to where you're kind of feeling the effects anywhere within the 15 to 20 minutes. Much, much quicker than what it is for whether it be taken sublingually or whether it goes through the digestive system, based on it being the sugar molecule that carries the cannabinoid straight into the system.
Yeah, it's pretty hard, really. Like I have quite a few patients that really are a little bit anti the oils and they really just want that whole flower for that instant relief. And their most complaint is, look, it takes 2 hours to take effect. I take it at 10 and I'm still waiting at 12. I simply say, take it earlier. What time do you get home? 5 p.m.? Take it earlier. It's not going to hit you for 2 hours and you want to be in bed. It's pretty simple dynamics. It's not rocket science.
That's it. Like that. Look, that's pretty much as we were saying, is that you've got to start working this with your own rhythmic clock. You know exactly as to how well your body works. So if you're seeing that something takes a couple of hours to take effect, that's what you need to be working with. Now, as you know yourself, Deb, you can only recommend when people have to take it. They have to work with themselves when they actually need to take it.
That's exactly right. And it's an individual thing. As I always say, we've all got feet. We don't wear the same shoes. We've just got a question in regards to that night strain, Robert. Was a night strain decarb before it was made as tea in order to activate the THC?
So this was we given the patients a procedure to decarb it, and whether or not they were able to decarb it correctly has always been has been a question. So it has. Hence why further studies from that, we took the tea out of it completely and just had it involved with vaporization, combustion, and oil.
Exactly. And once again, I will just say this isn't constituting as medical advice. Always get advice from your medical practitioners. So we did have a couple of questions sent in early on, was in regards to persistent pain due to a mastectomy and radiation. Now been 6 months from operation, 3.5 radiation. And this person actually asked, would they like to know, they would like to know more about medicinal cannabis. We're not medical advisors. You do need to seek that information from your practitioners. But I would say, just in my clinical experience, persistent pain following any kind of surgery or, cancers and I guess, that surgical impact on the body. We do see a few pain syndromes come from that. That's clinical experience. It can be costal brachial nerve injury. It can be those intercostal neuromas. You've got phantom breast pain as well, musculoskeletal pain syndromes, things, and then you add into that kind of various syndromes that can come from that impingement syndrome, shoulder issues if the breast has been removed. So things that medicinal cannabis can potentially help with, but they're all something that you discuss in very in-depth conversations with your medical practitioner. We're not really here to advise on that. This was particularly about certain strains, but I hope that kind of helped in some way. There is some space out there for its use for the practitioner in regards to that. Question here, Robert, around PTSD, retired firefighter, 30 years of active duty, was retired medically unfit. Several years later, actually had a diagnosis of PTSD. But after he was diagnosed, he realised that it actually been troubling him for many years. So he actually thought he had to live with it. He hasn't gone into any in-depth more information around that. I don't know whether he's found a way to alleviate that. I think he was just letting us know. And there was another question here around veterans. Robert, this is probably for you, or Derek, if you're on. Because many veterans already have drug and or alcohol addictions, do you guys think that DVA maybe are a little bit reticent in prescribing the CBD, THC, CBD, because it will obviously be necessary for those patients then to be weaned off other medications, i.e. have rehab and those types of things, which would then lead to more cost of money? Well, I think the No More Warriors, No More Zombie Veterans have already showed a lot of evidence and data around how much cost savings medicinal cannabis can potentially have to veterans. But did you want to speak to that, Robert?
Look, as you know very well there, it's a scenario where if you're finding that cannabinoid varieties are effective for you, then you can start reducing other medications that you're taking. But as you know yourself, that's not something you can just start to do. You can't just come off a medication overnight. You've got to work with your prescriber and your doctor over a period of time as to how that exactly going to be effective. So really it really depends on as to how effective it's going to be for you.
Exactly. Very independent medicine, as we say. It can have some...
There is obviously the cost factor there with regards to it. Like, yeah, cannabinoid therapies are relatively cheap compared to some of these other medications, which are, astronomically expensive.
Absolutely. Well, I don't think there's any other questions. No one else has popped any into the chat. There is one there that might need a little bit of a more in-depth answer, so that will come. I think that's a wrap, guys. So thanks again. We look forward to seeing you at the next episode. Look out for that link. And really thank you so much, Robert, for all your experience and everything that you do share with us in your own time. Remember again, guys, absolutely not medical advice here. We're just sharing information. Please reach out to your medical practitioners if you want some clinically evidenced advice there. And thanks again for joining us. Have a great and wonderful night.
Thank you, everyone. Bye-bye.
Thank you. Bye-bye.